Okay, class, now we're going to talk on the pulses. Now, we already discussed the pulses a little bit when I did the mathematical formulas for blood vessels. So let's discuss it a little more. The pulse rate is generally the same as the heart rate. Hear my word, generally. Okay? And doesn't always have to be. I'll mention that in a little bit just to show you. But generally the pulse rate's the same because it would be during the time that you do ejection contraction. The pulse pressure we talked about, so we won't get on to that much. It's the difference between the systolic blood pressure and diastolic. Best place to look is go back to my mathematical formulas. Now, however, you remember I said that when you feel your pulse, you're doing it qualitatively. And of course, nurses would be feeling the pulse to see how it feels. So in their nursing notes, they generally use this scheme here. 0 absent, 1 barely palpable, 2. But you can see it depends on the nurse. They have to have very experience because one might think a 2 is a 3 and vice versa. All right. The locations that you feel the pulse. And you can do this on yourself. Just kind of, okay, first of all, where can you feel a pulse? You feel a pulse where an artery comes close to the skin and underneath it is some hard prominence. Because first of all, you have to feel the pulse where an artery comes close to the skin. Pulses are in arteries. And if you touch it, you can't have it to disappear in the tissues. So it has to be something where you can push it a little bit and it won't just disappear. So you need some firm prominence underneath. Okay, when we look at the pulses then, let's just kind of talk about some locations. Some you may not be as familiar with. Okay, if you take your hand and lightly put it up on the temple, that's the temporal artery. That's the pulse there. Some people, which you don't have right here, will have a pulse. If you lightly take your finger, put it in front of your ear, real lightly, some will have what we call a pre-auricular pulse. A pre-auricular pulse. Down here, you can feel at the mandible, some will have this facial artery pulse. Now, everybody, hopefully, will have a carotid pulse. That's felt in the neck there. Nothing should be up in here. If you do, there's something wrong. Then you should feel a pulse, this brachial. Now remember, that right there is the antecubital fossa. Right here is the radial artery. Now always feel your pulse, never with your thumb because you'll feel your own pulse. So just lightly touch it with other fingers. Here would be the femoral artery pulse, the femoral. Some will feel a pulse, but depending on how much fat you have behind your knee. Remember, that was the popliteal fossa behind the knee, may feel the pulse. Right here, you'll feel, this is what we call the posterior tibial, and right here is the dorsalis pedis pulse. So these are kind of the usual areas that you can feel the pulse. Okay? And again, it's where an artery comes close to the skin, and there's some firm prominence underneath. Okay? We talked about pulse pressure. Sometimes, and so when you're looking at the pulse, remember, it's when you go from the high, which is ejection contraction, to the low. And that pulse pressure is the difference. We already talked about it. That difference there. I won't get into that. You can look at this and we kind of hit that. Here are some abnormal pulses. Remember I said that sometimes the pulse rate and the heart rate are different because sometimes the aortic valve may open twice if you have trouble with the valve. We won't get into this pathology, but I just wanted to show you some abnormal pulses that can occur and so forth there. All right. So now where we are, we want to look at blood pressure control. Blood pressure control. So I'm going to exit this PowerPoint here, and we're going to look at blood pressure control. That's going to be our next subject there. What controls the blood pressure? All right, so we'll close here.